Thank you for joining us today for our daily briefing to provide information to Tennesseans around our efforts at attacking this COVID-19 pandemic that's making its way through our state in all of the ways that it affects Tennesseans. I want to remind every citizen in our state that our Safer at Home directive that has closed non-essential businesses is in effect. Businesses across this state are bearing the brunt of that in an effort to make it possible for Tennesseans to stay home. I want to remind Tennesseans that this is the most important action that you can take. We all have a role to play in protecting our neighbors and our citizens against COVID-19. As simple as it is, staying at home saves lives. Right now, in this fight against COVID-19, heroes stay at home. We need Tennesseans to do that in every corner, in every community in Tennessee, and together we can fight this COVID-19 pandemic that is making its way across Tennessee. Today, I want to address a number of things. I want to talk specifically about the collateral damages of COVID-19 in our state. Yesterday we talked about mental health and the great challenges that are arising, mental health challenges that arise as this crisis sweeps through our state. But today I want to give particular attention to child abuse and domestic abuse, another collateral damage as a result of COVID-19. I'm also going to give an update regarding our aggressive efforts to gain personal protective equipment. I want to talk about our surge plan to provide additional hospital beds in our state as we prepare for the surge in the weeks ahead. And I want to give an update regarding Medicaid waivers and particularly those that are uninsured in our state. To date, we have 2,683 confirmed cases of COVID-19 and 24 deaths. We've lost 24 Tennesseans in this pandemic. All the more reason why Tennesseans need to be vigilant, to do their part, and to stay at home and to stay apart from one another. To date, we've tested more than 32,452 Tennesseans. We continue to lead peer states in testing per capita, and that is a very important piece of information to know, because the more we test, the more positives we will have, but the more we know about who has it, and the more effective we are at actually attacking this as it moves through Tennessee. I want to talk about collateral damage. Today is the first day of National Child Abuse Month. Yesterday I talked about the mental health aspects and the collateral damage there. Today we want to talk about another collateral side effect of this pandemic, the rise of domestic abuse, and particularly child abuse in our state. The first day of Child Abuse Prevention Month is an important day for us to talk about this. As schools are closed and more of our children are outside of the structured environment that they normally are in with school, I want to remind everyone, each of us are mandatory reporters of suspected child abuse. We encourage neighbors and friends and family and parents to be vigilant during this time of seclusion and social distancing, to call the child abuse hotline if they suspect any incident of child abuse or neglect. Reports can be made online at tn.gov/DCS or by using the MyTN app. The Child Abuse Hotline continues to operate. It's never been down during this crisis. DCS hotline staff continue to follow the same protocols to ensure that all reports of child abuse and neglect are screened and investigated. Child Protective Services investigators are still going out to make face-to-face visits to make sure that our children are safe across this state. I urge all Tennesseans to be vigilant, to be engaged, to be certain that during this time of crisis, we don't add additional crisis, that we don't have additional damage, and that children are safe and protected And where there's any breach of that we are certain to report it in our state. And we will be vigilant as well to make sure that we follow through on that. Today, Department of Children's Services Commissioner Jennifer Nichols is here, and she will be able to answer any questions when we get into the question period about our continued efforts around the prevention of child abuse. I want to give an update on PPE update on our efforts at securing and acquiring the amount of PPE that we need in the days ahead. I'm going to talk a little bit about a staffing portal that we are bringing up to make sure that we increase the number of healthcare workers in our state. I want to commend once again the healthcare workers who are putting themselves on the front lines, who continue to go into work every day, who continue to fight on the front lines with those who are infected. We are deeply grateful for those healthcare workers. We want to do everything that we can in this state to provide more of those workers and to support those who are again, as I said, on the front lines of this attack. More than 18 million items of personal protective equipment totaling about $45 million worth have been acquired in the last several weeks. As of today, every single county in Tennessee has received a shipment from our Unified Command Group into their region. We are not only making sure that we have sufficient PPE to meet the current needs that we have in our urban centers and in our towns and cities across, but we are providing PPE to every county, to our rural communities as well, to our first responders out there, who also are putting themselves on the front lines of this effort. We are working diligently to secure and procure and provide for that much needed PPE equipment and those medical supplies to every provider that needs them. You can be in contact with our TEMA officials to make certain that your region is sufficiently prepared. We all know this is a very difficult thing to do. There's not a large supply of PPE, but we're finding it wherever we can, and we are trying desperately to stay ahead of the curve, and so far we've done a really good job of that. But it's because of the efforts that people out there in the communities, private providers, nonprofits, companies across the state that are helping us in our efforts to secure PPE. We also received a critical threshold with the creation of face shields. I showed a week or so ago how our institutions of higher learning, our TCATs across the state, partners are innovating to bring forth PPE in innovative and creative ways. We have now produced 10,000 face shields through 3D printing efforts at our higher education institutions. This effort is one example of many examples that we see across the state where companies are innovating, where our colleges and universities are innovating, our private medical providers are innovating to make certain that we have the equipment needed for our frontline medical workers in the days ahead. Unified Command is also currently working with the U.S. Army Corps of Engineers in surge planning. We are planning to make sure that we bring online thousands of additional hospital beds in every major city in our state. These backup plans are currently being actively assessed, and proposals are being made, and plans are being drawn, and action is actually already being taken to make sure that we bring thousands of beds online to serve as overflow in our major cities. This work is being done in partnership with our private healthcare providers and with the Hospital Association itself. Unified Command is working together with the Army Corps of Engineers and the healthcare providers, who each are providing their own emergency plans for ramping up beds. And what we are trying to do with the U.S. Army Corps of Engineers is add to that staffing of beds and add to that provision of beds across our state. We're going to need thousands of additional beds as the surge hits in the next few weeks in Tennessee, and we want to be prepared for that surge. I'm going to share a little more about the planning and our specific work with the Corps of Engineers At our briefing tomorrow, we'll have more definitive information about numbers of beds and locations of those sites, but just know that that effort is already underway, and we are preparing to bring online those additional thousands of beds. With our surge plan, and we're also placing an urgent call to healthcare workers all across this state who are either currently displaced or furloughed, or those who want to be engaged in this process and currently are not a part of the healthcare force that is out there today. Unified Command is launching a website for you to be able to be a part of our surge planning. We'll be providing details of that website soon, but we want to make a call out to all healthcare workers. Get on that website, see where the needs are, see where you can be used. We're going to need every available healthcare worker. We've lifted restrictions and licensing requirements to add to the number of folks that can help serve Tennesseans in our state through this crisis, and we are going to make it as easy as possible to give you information about how you can engage and to provide a pool of information about the healthcare availability of healthcare workers in our state, and to help, again, to provide the needed resources for the surge that we see coming in the weeks ahead. As we address the strains of COVID-19 and the strains that it has created on our healthcare system, we're also addressing a potential strain on our healthcare safety net and care for the uninsured. TennCare submitted a waiver application and received approval yesterday that provides a great deal of flexibility and additional funding in our efforts to serve our Medicaid population. But we also want everyone to know that we are providing additional resources and services to our healthcare safety net. We have providers in virtually every county in the state through our county health departments for any of those who are uninsured, who need testing, who need care. These healthcare safety net providers have partnerships with hospitals to be certain that the care needed for every Tennessean is available with regard to their health needs around COVID-19. We want to make sure that Tennesseans know that we are working hard to prepare access and treatment for those who need it during this upcoming surge of COVID-19, and we are putting in place the network to make sure that that is available. I want to ask Dr. Piercy to come up in just a moment and give a healthcare update, some of the facts and the numbers around information that's important to Tennesseans. But I also just want to remind everyone as I close my part of the remarks before Q&A, as I've said every day and will continue to say, there is a storm over our state. It is intense. We are doing everything we can to protect the citizens of Tennessee against the damages of this storm. But be encouraged and be hopeful. It is passing. There will be a day when these clouds break, and when they do, we have great hope that the picture here will be one that mitigates to the greatest degree possible the health damages to the folks in our state, the economic damages to those who are suffering, and that we can provide relief to folks all along the way as we work our way through this crisis, and to help people get back on track as they face the difficulties that so many Tennesseans are facing across our state. Do your part. Stay apart. Together, we can accomplish this. Together, by staying apart, we can actually save the lives of Tennesseans. Now is especially important as we face a surge over the next several weeks, and we implore and encourage Tennesseans to be a part of this together. Dr. Piercy, would you come up and make a few more comments before we do question and answer?
Thank you, Governor. As mentioned, today we have 2,683 cases in virtually every county of the state. Shelby remains the leader at 496 cases, and Davidson with 423. That's not unexpected because that's where our population is, but those trends are concerning. We have now had at least 200 hospitalizations and 24 deaths. One update, yesterday we talked about being able to report death by county by the end of the week. That information is actually live on our website now. And so you will have that data available to you. As the governor mentioned, we have done over 32,000 tests, and we are pulling away from other states. We are testing at an unprecedented rate, and we're really proud of that. That will help us to better identify cases so we can better mitigate our risk and prepare accordingly. Speaking of preparing, our hospitals are prepared. We monitor their assets closely, and in a statewide aggregate form, we have 32% of our inpatient beds available, 32% of our ICU beds available, and 69% of all ventilators, traditional ventilators, available. That doesn't include the alternative ventilators and the new ventilators that we've talked about previously. As the governor mentioned, we continue to watch our vulnerable populations and make specific preparations and specific plans for them as needed. That concludes my formal comments, and I'm happy to help the governor take any questions.
I want to remind folks on the line that are calling in for questions that we have members of our Unified Command Group here. Major General Holmes is here, Dr. Piercy is here, Jennifer Nichols, who heads up our Department of Children's Services, is here, among others, to answer questions. We want to provide as much information as possible, so we will be happy to take your questions.
Thank you, Governor. We'll start off with questions. First going to Sergio Martinez Beltran from Nashville Public Radio. Sergio, your line is open.
Thank you, Gilliam, and good afternoon, Governor. Thanks for answering our questions today. My question is actually for Commissioner Piercy. I'm wondering, has the state's contact tracing approach had to shift? We've heard that tracers are overwhelmed, or that in certain communities, transmission is so widespread that tracing is not that useful.
That's a good question, Sergio. I would point you to the Washington State experience, and that's something that we're dealing with here as well. As the number of cases continue to grow, the ability to do detailed contact tracing does diminish, at least in a timely fashion. We will continue to do contact tracing on every single case, but just as with testing and with other efforts, we have to prioritize those to the most vulnerable populations, and that's exactly what we're doing. So if you consider that each case may have had 20 or 40, perhaps even 100 contacts, that is a very time-intensive process, and so we're having to prioritize that work now.
Next, we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Yeah, Governor, this morning on a phone call with lawmakers, you and others in the administration said you anticipate shortages of beds and ventilators. Do you have a target on when that shortage may begin, specifically a date? And is there anything else that the state can do beyond encouraging people to wash their hands, telling people to get tested when they're sick, and encouraging people to stay at home? Are you looking at more drastic measures like mandatory curfews or roadblocks or anything like that?
Yeah, we just, as you know, there's a wide range of efforts across the country, none of which have given much real data or evidence of what is most effective in social distancing. We do think that what we have done will make a significant impact in the ability for people to social distance. When you close all non-essential businesses in every corner of the state, it limits the movement of people because there's much less reason for them to move to go to one of these non-essential businesses or to work in those non-essential businesses. So the effort to close those businesses and to urge Tennesseans to stay home will, what we believe, will substantively change the social distancing policy in our state. What was the first part of your question, Joel? I'm sorry.
Specifically about, do you have a target date for shortages of beds and ventilators? I know you had mentioned that you expect that to happen, but any idea are we talking in a week? Are we talking 3 weeks?
Well, what we believe is that currently we have less than what will be anticipated at the height of the surge. That's the shortage that we've talked about. There are a number of models right now. We're working on this IMHE model, We are anticipating, actually today, we've been working really hard to try and get a more Tennessee-specific model, and we're working with Vanderbilt to get that, and we have a part of that model, but right now we're trying to meld those models to get a better picture. But the current model that we're working off of shows a shortage based on what we think the surge will look like in about 3.5 weeks. So we actually have a date of April 19th, I believe, or April 20th for the peak numbers in our state. We know what that shortage would look like, what the numbers are in that model based on the numbers that we have available. And we also know that every provider, public provider, is already putting in place additional beds. We are, as I said earlier, we have a plan to bring up thousands of additional beds. So our hope and our belief and our plan is that the shortage will actually be met. Of course, we have no idea exactly what that shortage is going to be, but our plan right now is to prepare for and meet that shortage. Exactly the rate at which those beds will be needed is unknown. We haven't seen an exponential type rise in cases so far. We certainly are having a significant number of additional cases daily, but that surge is going to increase. We believe that that's going to happen based on the models. So the shortage refers to the difference between what we think we will need on that date and what we have right now, but we actually are planning to close the gap on that shortage, so we actually hopefully will have all the supplies and the beds necessary to meet that current shortage. That would be true also of equipment, of staffing personnel. That's why we're doing this staffing portal and this pooled resource effort. All of those are efforts to close that gap that currently exists, but we believe and we know that that same gap will not exist when the time comes.
Thank you.
Next, we'll go to Stacy Case with Fox 17. Stacy, your line is open.
Thank you, Governor. The Tennessee medical community said today they are not divided. They want to know why we don't have a shelter-in-place order. They say it's really a matter of life and death at this point.
Yeah, I've heard from the medical community all across this state. I got a letter today from a whole host of medical providers that are an organization in one section of our state that actually was supportive of the efforts and said it was the right move. The reality is that there are differing opinions about the right strategy to implement social distancing policies. It's why you have probably 25 or 30 different type models in different states across the country that vary in their approaches. Every state trying to put in place the right approach for their state, for their demographics, for their population, for the number of cases that they have. That's the effort that we have made, and there are some in the medical community that don't think we've gone far enough. There are others in the medical community that are very supportive of the efforts we've taken so far. There are a lot of views, and they vary widely, but as I said before, discernment is difficult when there is so much differing information. Even as I said before yesterday, some of the governors of the hardest hit states now question their approaches as being the best public health policy. At the end of the day, Tennesseans need to know that we have made what we believe is the very best decision at the very best time to provide for the best guidance toward mitigating the spread of this virus in Tennessee. And our efforts are solely focused now on providing the appropriate amount of equipment, the right number of beds, the right number of medical providers to meet the surge that's coming in the weeks ahead.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
Hi, Governor. So exactly how many people are estimated in this surge, in this modeling that you're seeing?
Yeah,
and how many more beds will you have?
I don't have
or how many beds do you want to have?
We want to have, we need somewhere, it depends on the modeling, the sort of worst case modeling that we see shows that we need about 7,000 beds that are in part already being provided. So the work is already underway with our private providers, and we already have a plan, a partial plan with the U.S. Army Corps of Engineers that we'll be giving more information about tomorrow, but we anticipate somewhere of a need more than of a max need of 7,000 beds, more than what is currently or what is traditionally available. A lot of those that bed space has already been met as hospitals and healthcare facilities have suspended elective surgeries. That frees up beds, so there's a greater capacity today than there was previous to that executive order. Major private providers of healthcare, major hospitals across this state have already started putting in extra bed capacity. We don't have those numbers yet, but we are coordinating with the Hospital Association and those private providers. We are finalizing our plans for the numbers of beds that the state will provide on an overflow basis, and the goal is to bridge that gap.
So would that mean like convention centers and hotels?
That's
and
right.
That sort of thing?
It certainly could be. So the way this is working is the Corps of Engineers has been assessing sites, including convention centers, hotels, dorm facilities. They've been assessing potential sites in our major cities and making recommendations about which sites can be turned around the quickest and which ones are going to provide the right kind of atmosphere for what we need in a surge. And that's all in process, and in very short order, the state will have its plan. Many of the private providers have already developed their plan and are building out their additional bed capacity.
If one more question, I mean, what is the projected surge? Is it?
You know, Andy, I don't have that number. I don't have that number of people in front of me. Yeah, we don't. I don't have that in front of me. We have that information based on there are a number of models, you know, so we're trying to look at all the models and determine which one seems to fit our state. We're working aggressively on that, looking at multiple models and trying to get the right number. Our strategy here, however, is to kind of plan for the worst. Like, we've taken the models that are the most conservative and most aggressive, and we've set our sights on bridging those gaps. If it turns out that we don't need all those beds that we put in place, that will be great, and that is our hope. Same with every other piece of equipment that we're trying to procure to prepare for the worst case scenario. We believe what appears to be, the models tell us, as the worst case surge. If we do better than that, then we're all going to be really grateful for that. But those are the numbers we're working with. I don't have the actual number of cases in front of me, but we have that. We have that with us.
And we'll provide that, right?
We're happy to provide it.
Thank you, sir.
Next, we'll go to Robert Grant with WVLT. Robert, your line is open.
Governor, thank you. You just said that you guys will need 7,000 beds about when that peak hits. How many beds do we have right now across the state? And also studies are showing that we'll need about 1,800 ventilators as well.
That's right. Do you want to address numbers of beds that we currently have? Well, let me just say this. We don't know exactly how many numbers of beds because they change by the hour. You know, hospital bed capacity fluctuates with, there are a lot of other patients for other reasons in our state that are occupying or clearing beds. So those numbers literally do change by the hour. And as these elective procedures have been suspended and the folks that were hospitalized because of those procedures, as their beds become available, those bed numbers change as well. So where we are right at this moment is not particularly reflective of where we think we might be in a day or two or three, but you can address specific numbers.
Sure, thank you, Governor. So I have the specific numbers with me, but I don't have the denominator, but if you can do the math, then you can do that. I have 3,414 inpatient beds available, which is 32% of our overall capacity. So 68% is what's taken up right now. I have 534 ICU beds statewide available and 838 ventilators statewide available. As the governor pointed out, it's very important to remember that these are all just traditional day-to-day bed and ventilator availability numbers. Hospitals each one of them have plans, they have surge capacity, and so they can ramp up both in bed space. They have lots of different levers they can pull to increase that capacity without any external intervention whatsoever. So they have that trigger they can pull. We have additional supplies and assets that we've ordered, and then we have alternative supplies that we can convert in crisis situations. So those numbers are just the traditional day-to-day numbers.
I'll say also that we have a number of licensed unstaffed beds right now that are significant in these numbers. I don't have those in front of me, but those are not included in these numbers. And we're also developing a plan, and we're going to announce the details of that. It's not finalized yet, but some financial assistance for our rural hospitals that will bring on extra capacity in each of those rural hospitals as well. Those bed numbers, because they're not currently being utilized, are not included in these numbers, but all of this is a strategy and a plan that we will be coordinating with cities, with counties, with the hospital associations, with private providers, and the state to bridge the gap between what we think is going to be necessary at the peak of the surge and where we are today.
Next, we'll go to Jeremy Finley with WSMV. Jeremy, your line is open.
All right, Governor, thank you so much for answering all of our questions. One of the issues that we're running into, and I hear you say this almost every day, that there's enough tests for everyone. But what we are hearing a lot from healthcare workers is that they are waiting weeks to get their test results back. So we have healthcare workers that are caught up in the backlog system that aren't able to go back to work and are self-quarantining themselves. It's not because they couldn't get a test. It's because their test results are taking so long to get back. Mm-hmm. Now, we learned yesterday that the state public health department, that their labs can return the results within 24 to 48 hours. But these healthcare workers say nobody told them that they should ask that their test results be sent to the state public health lab. So now they're caught up in this backlog. So I wanted to ask the question, is there a concern that all of these healthcare workers want to go back to work, but they can't because they're waiting on their test results?
Yeah, I'll let you address that. But first, I think your first comment was that we've said over and over that we have enough tests for everybody. We don't have enough tests for everybody in Tennessee to take a test. We have sufficient tests for those who currently qualify to take a test, but I can tell you, I've also said there's a reason why Tennessee is testing at a higher rate than most states, because weeks ago, our administration believed that based on data from countries that have dealt with this crisis before ours, that the best results were found in those countries, in those regions of the country that tested at the highest level. So I tasked our team with an aggressive approach to testing weeks ago. We were one of the first 5 states in the country that implemented testing. We were one of the early states to bring on these remote assessment centers. And I say that because even though we're aggressively testing, we're not testing as much as I would like to. We are hopeful that more and more Tennesseans will be able to test that have less and less restriction on those who qualify for testing. There are some very promising, soon to be delivered to the market, hour turnaround type tests that are that can be delivered in great quantities. We're waiting for those. We believe the whole nation is waiting for them, and there's evidence that they'll be here soon, which will actually allow us to test more and more Tennesseans who qualify with less and less symptoms or reasons to be qualified. So right now, anybody that drives up and wants a test can't get one. So everyone doesn't have access to a test. I wanted to make that clear first. we are aggressively testing, better than most states, but we're not doing as much as we want to, and we hope that we're going to see those numbers even dramatically increase in the days ahead, which will raise our case number, but it'll also give us a lot better picture about where the most important places to focus our efforts are. Now, specifically on testing time turnaround for healthcare workers, I'll let Dr. Piercy address that.
So you're correct. The State Public Health Lab does issue priority testing for healthcare workers and vulnerable populations, and we can turn that around in 24 to 36 hours under typical conditions. To date, we have not had any backlog, and so as long as we get samples into the Public Health Lab by the cutoff time, which I believe is still 7 a.m., we can have those results the same day. Obviously, we don't have the capacity to run all of the tests in Tennessee, and so the large percentage, as you can see in the data on our website, are run by private labs. Many of those, most of those, are not in this state, so there's travel time associated with the specimen, and then there's backlog in those labs. I did get some good news today that the 45-minute test people are starting to get in components of that and may be able to put that into use as soon as the end of this week. That will significantly enhance capacity as well as turnaround time. And finally, I've been in contact with one of our very large lab providers here in Tennessee, and their expansion for throughput and capacity is set to go online next week, and that will be exponentially more capacity than they've had now. So all things testing, we're doing well, and the news is getting better by the day.
We do, by the way, just to finish that question, we're aware that test turnaround time is particularly challenging for us with healthcare workers, and the challenge that we need so many healthcare workers is the reason that we're pushing hard for these quick throughput tests. And if we can get that done in anticipation of and in the week ahead, within the next week or two ahead, then we can get those quick turnarounds and get people back to work before the real surge hits or the peak of this surge hits in 3 to 4 weeks.
But Governor, I did want to just clarify, if I can, the healthcare workers are upset that they are now, some of them have waited 2 weeks to get their test result. Yeah. So was an opportunity missed here to get them their test quicker. They ultimately were not in the system to ultimately get tested at the top of the list.
Yeah, well, we've said multiple times across the state that the state lab is providing priority for healthcare workers. Obviously, healthcare workers there are thousands of them across our state, and their access to testing is in multiple different places. But if they utilize the state lab, then that turnaround time is quick. We realize that many of them are not, and this particular challenge on turnaround time, because of the national backlog of testing, and if you look at the testing curve in America, it has dramatically increased in the last week or two. Thus, backlogs in private lab testing facilities, which we don't control, but we certainly are encouraging. And as they bring on this quick throughput and quick turnaround testing, which we believe they're going to in the next few days, then it will help that situation. Where healthcare workers are tested, we encourage them to utilize the state lab testing facility because that will allow a quick turnaround. But meanwhile, we want to solve the problem even in our private labs. And nationally, there is a real effort to do that. As I talk to governors and the National Governors Association is working hard to improve that throughput for our national labs, which all of the states share, and thus has a tremendous backlog.
That's all the time we're giving to questions today. Governor, if you would like to make a closing statement.
We appreciate all of you tuning in. We appreciate all the questions. We want to continue to have questions asked and answer those questions. The more information we can give, the more Tennesseans know and the more they can engage. Once again, I'll just say it's up to us. That's not just us that are providing the environment for more capacity or greater efficient testing, but to every Tennessean. Every Tennessean in this state has a role to play, and we encourage you to figure out what that role is, step into it, and together we will accomplish this. We will do this together by staying apart. Thank you.